OCD help for parents who are starting to introduce ERP therapy with teenagers and children. Hi, I'm Julie, author of The Mind Monsters and creator of workshops and workbooks to help parents who are trying to navigate themselves through OCD. And today, in today's video, if you remember last video, I actually covered how to communicate better with OCD. That there are certain tweaks you can make in the way you communicate with your child that will help to tackle it. Today's video, I'm going to cover ERP therapy. So what is ERP therapy? ERP is short for Exposure Response Prevention Therapy, and it basically in a nutshell means when you expose your child to the greatest fears without them carrying out compulsions. Now, ERP isn't a quick fix and it's not an easy fix, but it has been proven to be the best therapy for tackling and managing OCD behaviours in children. So what do you do with ERP therapy? Well, the way that I tackled it under the guidance of CAMS was that we actually brainstormed and we wrote a big list of all OCD issues to be tackled. And I then got my daughter to score each one out of 10, with 1 causing the least anxiety and 10 causing the most. I mean, we did ours on a big, huge piece of card, but I mean, you can put it on anything. We've also done it on backs of menus in restaurants and everything. The important thing is to write it all down, because it starts getting your child used to the idea and the discomfort that they're at some stage going to have to tackle these anxious thoughts and compulsions. So we started making a list. It then begins then with you scoring it from 1 to 10, with 1 causing the least anxiety, 10 causing the most. And then you get your child to select the lowest scorer. Now, warning here that most of those scores, I'm guessing, are going to be pretty high. If that's the case, have your child to choose the first one, and that will become your first challenge. So you actually write your first challenge down then, and you agree together a realistic time frame for tackling that first challenge. Another word of warning, make sure you only ever do 1 challenge at a time, because that in itself is tricky enough. And you will need to break it down into bite-sized pieces. So let's just suppose you're going to agree to do something over 2 weeks. 2 weeks can be a low time frame. Mine, sometimes you might need to do a month, 3 months. I've seen ours sometimes take 6 months. The important thing is that you start tackling it and you just do it gradually, step by step, tiny step by tiny step. So let's just suppose you decide to reduce on a compulsion over 2 weeks. You would just decide in that 2 weeks how you're going to break that down. Is it going to be reducing 1 wipe a day? Is it going to be reducing 1 spray a day? Is it going to be reducing 1 tap a day? I mean, it all obviously will depend on what sort of OCD theme your child is suffering from and how serious it is with them. I mean, my daughter's is very serious. So as I say, that's something for you and your child and your therapist to sit down together and decide. But the important thing is to do it every single day, because even if you get professional therapy, a lot of this therapy will be down to you as a parent, because it's going to be down to you to actually action that plan. So that's it today, briefly covering ERP therapy, Exposure Response Prevention Therapy, to help manage OCD behaviours in children. Like I said, it's not a quick fix, depending of course how serious your child's behaviours are. And it's not an easy one, but it is effective, and it's what helped my daughter to free herself from a very isolated, miserable, lonely life, to be able to now be studying in a dream university in London and actually now finally enjoying life. All right, so I hope that's helped you parents as well on how to tackle OCD. And don't forget to tune into my next video, and in order to be notified that I've made a video, make sure you subscribe to my channel. I'll see you on the next video.